Let's talk about menopause. So menopause occurs typically in the mid-40s to around age 52. But menopause starts way earlier, sometimes as early as our late 30s, when women start to have irregular periods. The problem is that it's hard to connect the dots because when we look in the mirror, oftentimes we color our hair, we don't look like we're ready for menopause. And the problem is that symptoms come and go. So you might have 3 or 4 months of hot flashes and night sweats, some irregular periods, and then a few months later, you're back to your normal, typical schedule, and you're not having hot flashes or night sweats. You may not be sleeping well. You may notice some mood changes. You may notice that your skin is drier or that you're starting to develop more wrinkles. The thing about these midlife changes is that they're all related to declining estrogen levels. Estrogen is a natural hormone that we've had in our bodies since we were going through puberty. Estrogen is the hormone that gives us our curves, right? And helps us have our periods every month. Estrogen is a natural hormone that you have had in your body for years. And virtually every cell in your body has an estrogen receptor. So it's understandable that there would be tons of symptoms, from poor sleep to muscle and joint aches to dry skin to hot flashes and night sweats to loss of bone mass to depression and anxiety, even not being able to find a word on the tip of your tongue. This is all related to hormonal changes all through the body. So when people go through menopause, oftentimes there's 3 to 7 or more years of irregular symptoms. Again, they come and they go. And so you may think, there's something seriously wrong with me. Maybe I have a thyroid condition. Maybe I'm exhausted because I'm anemic. Maybe I have rheumatoid arthritis and that's why I have muscle and joint aches. And so often, we think that all of these symptoms are related to something else, that they're not related to hormonal changes and menopause. And many times we go see a healthcare provider and that provider hasn't had much education in menopause and they also don't connect the dots. And I've seen many patients who go to see multiple providers and everybody's scratching their head going, I don't know why you're having all these symptoms. But oftentimes it's related to these hormonal changes and the decline. So if you're noticing symptoms, the first thing to do is start tracking them. You know, we've probably found over 100 different symptoms related to menopause, from leaking urine to low sex drive to vaginal dryness. All of those things are all related to hormonal changes. So tracking your symptoms and watching, do they come and they go? If you're having irregular periods, that's a hallmark sign. So if you're having any bleeding at all, and if you've had any periods in the last 12 months, and you're feeling hot sometimes, and you're having night sweats, you're probably in perimenopause. That's the transition time before periods stop altogether. Because menopause is when there has been no bleeding and no periods for at least 12 months. What do you do then? The first thing to do is to ask yourself, how do you feel? How bad is it? And what do you want to try? A lot of people want to try lifestyle changes, and those are always a really good place to start. Healthy diet, lots of plants, lots of whole grains. This helps the gut microbiome. That's the universe of healthy bacteria in your gut. That helps with every aspect of your body. Also, regular exercise and weight loss helps. But we also know that things like having better sleep or cognitive behavioral therapy can help. These are things that we know will help people ease through this transition. We also know that some antidepressants, the SSRIs, the selective serotonin reuptake inhibitors, and the SNRIs, the selective serotonin norepinephrine reuptake inhibitors, these are also known to reduce hot flashes and night sweats by about 60%. And if you can reduce hot flashes and night sweats and you can get better sleep, you're gonna feel a lot better the next day. It'll improve your mood and it will improve your memory. So some of that brain fog may clear up. There's also a new non-hormonal treatment that works on the hypothalamus. That's the internal thermostat in the brain. This is called an NK3 antagonist. It's known as Veozah or fezolinetant. This also has been shown to reduce hot flashes and night sweats by 80% in the first 2 weeks of use, and there's no hormones associated with it. We also know that some women do better with hormone treatment. Hormones are kind of the gold standard. They work better than anything else, and they don't just work on hot flashes and night sweats. They help with virtually every aspect of quality of life, including maintaining bone mass and helping with sleep. And that's really important. Hormones aren't for everyone, but if it's something that you want to consider, I would suggest you go over to menopause.org, that's the Menopause Society, watch a few videos, learn more about the benefits of using hormones and some of the risks. Because over the last few years, all we've done is emphasize the risk of hormones, which are pretty rare. They're there, but they're very, very rare. And we don't emphasize the many, many benefits that women derive from using hormones. Another thing to remember is that you may decide, I don't want to use hormones for hot flashes and night sweats for my whole body. And I do this because it's systemic, it's your whole body. But you may decide that you want to use vaginal hormones to help with the dryness around your vagina and to help your bladder. We know that when women use vaginal hormones, those hormones stay in the vagina. They don't circulate through the whole body. They don't help with hot flashes or night sweats. They don't help maintain bone mass. But what they do is help the vagina be less dry, less odor. It also helps the bladder. It helps the muscle strength of the bladder because estrogen and these hormones, they help produce collagen in and around those muscles. So it helps with muscle strength. Many women find that by using vaginal estrogen, they have fewer urinary tract infections. They have less leaking of urine, less incontinence when they cough or sneeze or laugh, and less of an urge to go to the bathroom frequently. Many women also find that vaginal estrogen helps enhance their sex life. It helps them have more natural lubrication, and for some women, it really helps with libido. So don't rule out vaginal estrogen if you're not interested in using it for your whole body for those hot flashes and night sweats. Now, just a quick word about collagen. Remember, estrogen is a precursor hormone for collagen, not just collagen in your skin, right? So as estrogen levels drop, we see a lot more wrinkles because wrinkles are caused by lack of collagen. But that lack of collagen also impacts our muscles and our joints. So many women have muscle and joint aches in their hips and in their knees as their estrogen levels decline. You cannot absorb collagen by having bone broth or taking a collagen supplement. It's just not absorbed that way. So save your money and think about other ways to maintain your bone and muscle strength rather than taking an expensive supplement that just doesn't get absorbed. I hope this information has been helpful. You can find a menopause practitioner, someone like myself who's certified by the Menopause Society by going to menopause.org, putting in your zip code, and finding someone in your area who's certified. I hope you've liked this. Please click like and subscribe and leave me a comment on your menopause journey and the things that you're experiencing. Take care and be well.